work. I offer typically in my work for my OSHA consultations to businesses directly. I will hop in my state of Michigan car and drive to your place of business and do this type of work with you. However, due to the pandemic, they are encouraging me to do as much as possible electronically, which is part of our preparedness and response plan at my OSHA is maximizing webinars and telecommunications. So thank you very much for making the resource of this webinar available to me. And that's what I'm basically doing. Instead of driving to each of your places of work and working one-on-one with you, we are leveraging the resources of the Southwest Detroit Business Association, particularly their bilingual and translation services, to reach employers who may not otherwise be able to get a good resource for this compliance. So we're going to start out by running through the template. I'll take the mic and I'll kind of walk through it and explain what the various sections mean, interpret kind of what they're aimed at. And on the back end, we'll take a look at some resources that you guys can use in your places of business to get ready and to reopen. So
I'm just going to interrupt you for 1 second. I was planning on recording this and I had forgotten to hit record because I was waiting for all the introductions and things. So I did just hit record, and so we are currently recording. If you don't want your face on camera, please go ahead and feel free to stop your video. We will be asking people to participate later on in the program. But again, this is the MyOSHA workshop for your COVID preparedness and response plan. Today is June 23rd, so if you're watching this later on, things may have changed because this is a moving target, unfortunately. But and I am Bridget Espinosa, a consultant for the Southwest Detroit Business Association. And once again, we'd like to welcome everybody here. If you are just logging in, and I do see some additional participants, please, if you wouldn't mind introducing yourself in the chat. My assistant, Maida Orozco, is available if anybody needs assistance. And please, let's keep the chat moving the whole time, and let's put some questions in it for Tony. And I'll be interrupting him periodically and asking you all to unmute yourselves and to participate as well. This is going to be an interactive workshop. We want to hear your experiences and your questions about how to not just create the plan, but how to enforce it. So I think that's going to be, part of the challenge as we go forward. So thank you so much, everyone, for coming. And Anthony, go ahead and let's look at the template.
Great. So the slide that's currently up, that's coming up right now, the presentation is the low and medium risk employer template. So this was a document created by my peers, and I had a hand in it myself at my OSHA. And the purpose of this is to give employers a tool to comply with the governor's order. Before I start diving into the document, just so everyone understands, the COVID pandemic occurred in March. The Centers for Disease Control, the CDC, are kind of the experts on the disease and how individuals experience it, how it's transmitted, what's dangerous about it. OSHA is concerned with places of employment. So OSHA issued guidance that was specific to how businesses, employers, and employees should change how they do things in light of the pandemic, but it was still just recommendations. OSHA was still just giving best practices. Then on June 5th, Governor Whitmer issued Executive Order 2020-114. That took these recommendations and made them mandatory. So that's what we're going to really be looking at, is how you can comply with Governor's Order 2020-114. And this document right here is the first tool to comply with that. Just for your reference, I'm going to open up the Governor's Order. That should be up. And that is 115. Bridget, can you see the screen all right?
I can. Yep, you're doing good.
For 114, great. So if you take a look at Governor's Order 114, which is the law here in Michigan, the first thing that you will see in section 1A is all businesses or operations. It's at the bottom of my screen right now. I'll try to get it up a little bit more. All businesses or operations that require their employees to leave their homes or residences for work, right? So if you have an employee that you're saying you need to go to the store, you need to go to the customer site, you need to go to the office, or you're starting to come into the office on Monday, you need to have 1A, a COVID-19 preparedness and response plan. So we reference the OSHA guidance. You can click on the word here and that'll open up the OSHA guidance that we follow. But that's what the document that we're about to look at is. The governor said you need to have one of these plans. And the first question that came up was, okay, do you have a template for that plan? Where can I get a copy of that plan? What are you looking for in that plan? So that's what we're going to be doing today. So I'll get that document back up.
So everyone, I just put the document in a Word format. I had previously put it in a Google Doc format, which I know not everyone utilizes. So I did put it in Word. You are able to open that document and download it to your computer and begin working on your own plan as Tony's walking us through this. This is supposed to be a working workshop or a hands-on webinar, however you want to look at that. And so please make sure that you have that document open if you are a company or business or an organization that has not yet written your MIOSHA plan. If you have a plan in place, you do not have to use this template. It is a suggested format only. The City of Detroit, Wayne County, the DEDC, all of them have provided additional templates that you can use. But this is the most up-to-date from MIOSHA. And so I really would recommend that everybody have this document open and be working on it as Tony is talking. If there's a way to split your screen so you can see him and his work while you're working on your own, that's the best choice. Or you could even call in a second time so you have us on the call. Just make sure that you've got yourself muted. So go ahead, Tony.
Yeah, excellent point, Bridget. Yeah, I would like everyone as much as possible. You can complete this as we go. It's a template. So you'll see blanks. The first one is underneath general, where it says the following SARS-CoV-2 preparedness and response plan has been established for blank company name. That is the first field you would fill in. You would highlight that and write in your company's name. So every time you see one of those blanks, you can input that information as we go through here. So first things first, the program must be available. It doesn't need to be posted. It doesn't need to be physically present, but you do need to make sure that all your employees have access to it. So you could put it on a shared drive. You could have a hard copy for their review, or you could send them your plan via email as a PDF for their review. Just make sure that your employees do have a copy of the program. The main purpose of the preparedness and response plan is an exposure determination. That term means you're going to categorize your business. You're going to say how dangerous your operations are for your employees. And that may seem like a daunting task, but it shouldn't really be for most employers. OSHA divides the exposure determination class into 4 settings: low, medium, high, and very high. As you'll see, this program is for low and medium risk employers and not for high or very high risk employers. So who are each of those groups? How do you make that determination? First of all, you're going to put the company name and the job title of the person who's going to be making sure this determination happens in that top paragraph. There's 2 blanks there. Most businesses, most retail, restaurant, office, construction, et cetera, type businesses are going to be medium exposure risk businesses. So barring any unusual activities, your default setting should kind of be, okay, Am I medium, or am I doing something different that either pulls me down to low or up to high? What would those be? A low exposure risk job is a work from home job. It's a job that doesn't have contact with people. If you had a job where you drive into a building, you're the only person in that building, the public is not able to enter that building, that's going to be a low exposure risk job. You just don't have much contact with the public. Minimal contact with the public is the actual term. So we can talk about on the back end here, if you think you might have a low exposure risk job, or if you might have some low exposure risk jobs and some medium exposure risk jobs at your company. So if hypothetically you had a small retail operation where you had a manager who stayed in the back and who was not responsible for interacting with the public, they were more inventory or online sales, or they didn't really interact. And then you had a couple front people who did front end sales, cashiers, interact with the public. Your manager may be low exposure risk, and your front office workers may be medium exposure risk. So you determine by employee job. If you operate a restaurant, you'll make a separate determination for servers, for your cooks, for your dishwasher, et cetera, et cetera. As I said, most jobs will be medium exposure risk jobs. If you read the description for what a medium exposure risk job is, it includes people who have frequent and close contact with the public, even people who have high population density work environments, schools, retail settings where there's a lot of people inside, right? Grocery stores. Those are still medium exposure risk jobs. There's a lot of people present, but there's no known or suspect COVID patients. That's when you start getting into high exposure risk jobs. High exposure risk jobs are those where there's interaction, close interaction with known or suspect COVID cases. So what would that be? That would be medical offices, morgues, medical transport, right? Ambulance operators, people like that. People whose jobs are such that they have the responsibility of being in close contact with COVID patients. Real
quick, Tony, I just want to interrupt you a little bit just to kind of give you, I don't know if you're following the chat, just to kind of give you a background on who's on the call this morning.
Sure.
So it appears that everyone on the call is either a small business or an organization. We have a lot of orgs. We've got a lot of, people who work for or run different organizations throughout the state of Michigan. We have some contractors on the call as well. We have a couple of restaurants. And so there's no one on the call currently that works with or interacts with primarily high exposure. So I would say the majority of the people on the call are either low or medium.
So that's what I expected, and that means that this is a good template for the people on the call.
Correct.
If you're a high or very high exposure risk job, or if you have those, call me. My personal contact information was on the slide that was leading off this presentation.
And Tony, actually, if you wouldn't mind grabbing that and dropping it in the chat as well, or Mike, I don't know if you have it handy that you can do it for him. Maybe copy in.
So my business email and business cell number are now in the chat. And you can reach out to me directly if you think you may have high or very high exposure risk jobs. The ones that get a little tricky that I might have you look out for is if you have designated first aid responders at your business, or if you operate a janitorial disinfection style company, you may want to follow back up with me about that type of work.
I didn't see anybody in that category on the call yet.
Okay. So
we do have some clients that run those types of businesses, so that is good for us to know.
Yeah. So the big trigger is once someone says, I had COVID, I have COVID, right? Then you have a known or suspect COVID case. So that's another, if anyone has questions about what you do when you have that, we're normally medium exposure, but all of a sudden one of my employees has COVID. What does that do? We can talk about that as well. So the next page here is a table. This is supposed to be a user-friendly document. So this is where you would input your determinations. So if I operated a restaurant, this, in the left-hand column where it says position, that's where I would put waiter, cook, whatever. In determination, I would put low, medium, or high. And in qualifying factors, that's where, as an employer, you want to put the basis for your determination. If you're saying someone is a low exposure risk, you're going to want to put something in there that says why they are low exposure risk, why you think that they're lower than normal. So broad categories, it may be that you only have one type of employee at your business, but make sure that the table that you complete includes the various jobs at your facility. Make sure you catch everybody. Going down to the next section, this is where we start breaking what you're going to do at your place of business out. So engineering controls, you want to implement engineering controls to the extent you're able to. They remove the hazard from the workplace. They put something physically between the worker and the hazard. In this place, the aerosolized droplets that come out of a person's nose or mouth that may have the virus in them. So an example of an engineering control that they give here is physical barriers such as clear plastic sneeze guards. If you have high or very high exposures, which we don't, you would need engineering controls. If you have low or medium exposures, which we do, you don't need engineering controls. They're often expensive. You can look at things like installing new ventilation fans, new HVAC, that costs a lot of money. So you want to consider engineering controls, consider putting up sneeze guards, physical barriers, looking at other methods of protecting your workers. Maybe you have a rotating window or a slide box that limits physical contact with people, but you don't need to spend this kind of money for low or medium risk employees. You can do it if it's feasible, you can do it if it makes sense, but you don't need to break the bank putting this stuff in. So
that's actually really good information, Tony, because I know a lot of people have been thinking that was almost a requirement,
yes.
that they need, for example, I work with an insurance company that has very low traffic, and we were having this exact conversation, should I put up a sneeze guard for my receptionist?
I think
so you're saying that that's not required and not even necessarily recommended. Is that correct?
That's correct. So you want to look at feasibility. And I would argue that there's a lot of places where installing a plexiglass board would be feasible and a good compromise. It doesn't take specialized contractors. It doesn't take a lot of upfront money. You can then have an engineering control that you can point to. So I think that's kind of a good one. But no, if you look at your place of business, you say, look, we don't have any high exposure risk here. I've considered, putting up sneeze guards. I've considered putting up these other solutions, and here's why they won't work. You can put a reason why it's not feasible, and you can step down on the controls to the other more affordable controls. So what I'd like to, I don't know if we have any topics in the chat, but as we go through these sections, I think this is really where I would think the workshop value of the presentation would come in. If anyone wants to talk about engineering controls that they've done.
Yes, we've got a couple of questions, Tony, that I think we want to address right away. So we have, why is the questionnaire not included in this packet? I'm assuming that she's referring to the employee questionnaire. Do we have a sample of that we could share, Tony?
Yeah, I got a couple. So that's that comes a little bit later in the presentation. But
Got
we
it.
can jump
Thank
ahead
you.
to it.
Yeah, if you wouldn't mind dropping those in the chat, that would be fantastic.
Sure thing.
And then the next, because that actually is a really important resource. Not everyone's going to be able to be on for all 3 hours, so this would be a good thing. Mark Moreno from the Michigan Hispanic Chamber of Commerce
I'm going
is
to drop
also
the
asking.
county one, Bridget, because that's what we have readily available. But it's based on county. Wayne County. I've reached out to Wayne County Health Department. It sounds like they use one that's not terribly involved. So I think the Ingham County is good enough for Wayne County. If anything, it's a little more. But
okay, yeah, please
it's based on the county they do the business in. I just wanted to get
fantastic. Okay, so that is really good to know. You would go to your county, because we do have people from all over the state on this call. So you would want to go to your county's health department and see if they have that sample. So that is why the questionnaire is not included in this particular template. Also, so again, Mark Moreno from the Michigan Hispanic Chamber of Commerce is asking, should the paragraph be updated to reflect that the XYZ company has not implemented feasible engineering controls, or should it just be left blank if it was not necessary?
I'm still trying to get that health questionnaire, so we'll have to hold
it, no problem.
Question for a moment. Do I just drop that in the chat? Drag and drop?
Yeah, you see the word file?
Okay.
If you just click the word file, you can upload it, and it just uploads just like any other kind of like a a JPEG or whatever, and then people can download it if they choose. So I know one of the rules is that you keep these questionnaires, these daily employee questionnaires. Is it up to 3 years, Tony?
I do not know off the top of my head.
I feel like that's what you told us last time when we were talking.
That's Governor's Order 114 at the end. I think it tells you how long. I covered it in my last presentation.
Yeah, I remember you saying 3 years, so that's what we're going to go with that. It may not. We'll double check that before the end of the presentation. But one of the things that occurred to me is, keeping that amount of paper for that many years might not be like a very efficient or effective way of managing, considering you may have multiple people managing that over the years. Has anybody designed a digital tool yet?
Bridget, can we run through how to get this questionnaire into the chat for people?
Sure. Actually, if you want to email it to me, I can pop it up.
We might have more I got a lot of resources on my computer. I'd rather make sure I can.
So in the chat itself, there is a little box that says file, and then you click on that file and you can upload if you have that available to you. I'm not sure if it's only the host. Do you see the word file next to the word everyone in the chat?
No.
Okay, so you may not have access to it.
Okay.
So you could also drop them into the Google folder that I gave you. So I'm going to give that link again.
Okay, I think we got it now.
Got it?
Yeah, we're getting there.
Yeah, Andrea, that's exactly what I was thinking too, a Google form. That's exactly what I was thinking. And that way people could even do it from home.
Okay. I have a network disconnect.
Uh-oh, that's a problem. We're still seeing your screen, so that's good. Gotta love technical difficulties, right, y'all?
Yeah, so you can see this, the Ingham County health screen that's up right now?
No, we're only looking, because when you click share, you're only sharing, you're not showing your whole screen, you're only sharing your one document.
Okay, let me show you what it looks like.
Okay.
So this will let people see what it is. So obviously my home base is in Lansing, which is in Ingham County. So this is what I complete as part of my program. So I'm not sure why I'm having a hard time getting into chat.
So actually, Tony, what would probably be a great way to do it is I'm going to give you permissions in the Google folder, and then you could just you could leave that open and then just have it, you could just be dropping things into that folder, and that'll actually,
okay.
So do you use Gmail with your, or do you have a Google account with your state of Michigan email?
No, I do not.
Okay. All right now I'm just going to let it be open then. 1 second.
Yeah, I can't imagine that it's actually a network problem, given that we're on an internet call right now.
Right. There may be something different with just because of your
I'm gonna try one more time.
Yeah, you know, this isn't gonna work for me to be able to make it open because I don't want I don't want people to be able to delete things from this. So yeah, if you want to try just to email them to me and we'll pop them in as we go. So go ahead and keep going. We got kind of distracted here by some questions that we will absolutely get to in a little bit. So thank you all. And I apologize for some of the technical difficulties here. Yeah, so yeah, Tony, go ahead and share the template again. You have to unshare the workplace health screening. We'll get back to this health screening questionnaire, and I will, I probably can pull these up online and drop them into there because I'm assuming these are all available online. So I'll do that while we're working. So Tony, go ahead. You've got the floor again. Go ahead and reshare the template. You have to unshare and reshare again. Tony, are you still there?
Yes, I am.
Okay, good, yeah. All right, it looks like our numbers have gone up, so I am going to add the template into the chat one more time, just because if you log in, if you log in late, you cannot see the previous chat, or if you get kicked off, you can't see the previous chat. So Paul, you had a question about education, and we're not going to be covering schools today. They still haven't determined what's going to happen in the schools yet, and so I want to make sure that we don't get off. I know that the SCBA does have a youth program that we help to support, so we will, if you want to talk to Tony offline on that, grab his contact information, and we can have a separate conversation with him about COMPLAS.
Still be subject to this form, I assume.
Yes.
Yeah, it's still that, but yeah, I think it will be a little bit different. He did say though that it's you know, interacting with the public, so we'll have to figure out what that means. So yeah, so it would be this form still. It just would it may have some additional adaptions, and they have not determined all that. And I would, yeah, let's have an offline conversation with that. If you do work with children, I would strongly suggest making a direct appointment with Tony, and so that you can get those very specific questions answered. One other thing really quickly before we go on, you know, again, there's a couple of options here for the Google form, or the form that you are going to be giving your employees. Tony, a really important question is do you have to give a questionnaire to your customers or clients, or is it just employees? Are you supposed to be screening every customer and client that comes into your restaurant or retail space?
No. So the governor's order is specific to employees.
That's what I thought.
If you look at requirements for the public, that's going to be 2020-115. I'm a specialist in employees and employers. I don't know as much about the rules for the public, but I would think, you know, based off of what I've seen so far, only certain types of establishments would need any information from the public. For example, the at-home services, where your workplace is the public's house, they get some information from the public. They need a questionnaire for the resident of the house. But I don't think generally there's any requirements for the public beyond, you know, signage, you know, putting signs up on the front door, stuff like that.
Sure. Thanks, Tony. I appreciate that verification. That's what I assumed too, but I wanted to make sure.
Okay.
Thank you.
No problem. So I'm sorry we couldn't get that questionnaire up, but I'm
gonna Google it, and I'll get them popped up in a second. I'm gonna do them for the different counties that I know we're in right now.
And really, they're all very similar. They're symptom surveys. You know, Are you sick? Has someone you know been sick? How do you feel today? A lot of companies seem to be going to apps for this, which I think is a great idea, just because they're easier to keep the documentation on. So just to kind of drive it home, you can see this note here. If you have low exposure risk employees, no engineering controls are needed. If you have medium exposure employees, don't go making these massive brick and mortar changes. Just install some small engineering controls that you can point to and say, look, in order to make sure that the public stays 6 feet away from our cashier, we put this end cap in front of the cashier so they can't get too close to her. That's an engineering control. That's the type of thing you can put in this section. If you have not implemented engineering controls, I saw a question, I think, right at the end about that. Yeah, you could put, we have not implemented engineering controls. So you can see the word there is feasible. Feasible means we can get it done. It's reasonably accomplishable. So if it's not reasonably accomplishable, you don't need to do it. And I think that does look to how big your business is, what's reasonable. So engineering controls remove the hazard, right? And they're the preferred control. If we can have your employee working out of a box where they never contact the public, they're working in like a bubble suit, that's a very high level of protection. But most people can't do that. So usually what you do is you then step down to administrative controls. Administrative controls, the best way to understand them is their standard operating procedures, their employee trainings, they're reteaching people how to do the same job a different way. One of the most common administrative controls right now is minimizing occupancy. We have a policy, we don't let more than X amount of people into our store at a time. That's an administrative control. Other administrative controls are things like when you place an order, you wait in your car until we come out and get you. Or another administrative control is instead of having 20 people working first shift, we split them up. Now we have 10 on first shift, 10 on night shift. It's just changing work schedules, giving them different tools, doing more telework. A lot of stuff falls under administrative controls. They're often the best controls. They're low cost. All you need to do is communicate them to your employees and they can get a lot done. You don't need them, once again, for the low exposure risk group, but for the medium exposure risk group, whatever titles you had in that medium risk group, a good mental checklist is for yourself is if you have a medium risk employee, you will have either an engineering or administrative control for that employee group. Don't, have one or the other. And you can get very creative with administrative controls. I would love to, have a discussion, have a roundtable, hear what people have been doing for this. But really, it's just minimizing the number of people that are in an area and the amount of time that people are in an area. Doing more work outdoors than indoors, right? Just helping reduce the amount of the virus that could be in the air. The virus comes from people. So, reducing the amount of people reduces the potential amount of virus is kind of the logic here. Once again, we have a fill in the blank section. So for this table, you would put the position on the left and what the administrative control type is on the right. Feel free to go to town on this. Feel free to really fill this section out. It can only help if you have more items that you do. Scrolling down. Hand hygiene and disinfection of environmental surfaces. If you look at the two consistent messages from the CDC across time, they have always been social distance and hygiene. They have always been keep people as far away, at least 6 feet away from each other as you can, and wash your hands a lot and disinfect surfaces a lot. So they're two separate things. One is I've given them plenty of sinks, plenty of hand sanitizer, plenty of soap, plenty of, towelettes, whatever it might be. If you can, put in information on where these facilities are. In our building, we have one for the public and one for the employees. The public one is out here. The private one is back here. We've recently purchased, a significant amount of Dial soap or whatever it is. So you don't need to put that information in here, but if anything ever came up in the future, it can only help to have more information in here. So hand hygiene, a great idea. If you haven't yet, show your employees videos on how to wash their hands. Have signage up on proper hand washing. CDC has both those resources on their website. So in addition to hand hygiene, you have disinfection of surfaces. This is the janitorial, custodial side of things. First of all, whatever you were doing before, you want to show that you're doing more now. If you had a shift cleaning schedule where at the end of every shift you cleaned, it would be a good idea to have a twice a shift cleaning schedule now. If you had a separate contract service that came in once a month for a deep clean of your facility, maybe you still have them do that, but it's also specified they do that following any known positive COVID case or something like that. So one of the tricky things is, like I said, we started out with CDC recommendations that became OSHA guidelines that became Michigan law. So carried through all that was use EPA approved disinfectants. You can Google EPA approved disinfectants and their website will have a list of those. They're often sold as such. I will let you know right now, 1 in 10 parts bleach is an approved EPA disinfectant. So it's not like these are unachievable, out of stock, I can't get it stuff. If you look at the list, there's some stuff on there that you can make at home. That's readily available.
Could you repeat that, Tony, and I'll put it right in the chat.
Using an EPA approved disinfectant. There are many. You can Google the EPA approved disinfectant.
Yep. But you specifically talked about the ratio for the
1 to 10 bleach to water. So that's sodium hydroxide is what bleach is, household bleach. So it's 1 to 10 sodium hydroxide, I think technically, but
yeah. So if you put one cup of bleach to 10 cups of water in a bucket, that would be a standard disinfectant.
Yep, that's an EPA approved disinfectant. You got it. And I think there's above 60% isopropyl alcohol, but don't quote me on that, is one as well. And then, so the 1 in 10 actually lasts a certain number of days. And they also, I think, permit 1 to 100 for immediate use. But, I don't have all that memorized.
Yeah, no, that's fine. I just thought that particular one was good.
It is. Yeah, it's easy. Yeah, it's real easy to use. So, just because I'm an OSHA guy, make sure if your employees are using that, they're using it with eye protection so they don't get splashed in their eyes.
Right.
But yeah, so use the right disinfectant and use the right protocol. You don't need to spell everything out in a huge document, but this table here should be used for your cleaning methods. So for example, a surface like a doorknob, your exterior doorknob, should be cleaned multiple times a day, maybe multiple times an hour. Okay, a lot of people touch that. A surface like a cashier's counter is also highly touched, but not as much, right? Everyone touches the doorknob. Some of the people touch the counter. So slightly less often for that, and so on and so forth. The more touched the surface is, the more often it should be cleaned. You can go to the CDC website and they'll have frequency recommendations that you can look at. But if you start talking to each other about what other people are doing, you'll notice that a lot of it is daily and a lot of it is more frequently than daily. So we're talking a lot of cleaning. Enhanced cleaning and disinfection. That's going down to multi-step processes. Cleaning is removing dirt. Disinfection is neutralizing infectious agents like COVID. So an enhanced method would be something like a rag wipe to remove visible soil and dirt. Allow that to exist for 5 minutes. Then I apply my disinfectant, give it adequate contact time, right? I don't spray and wipe. I spray, I wait 5 minutes, then I wipe. That's what kind of goes into the enhanced methods. How you do deep cleaning. The best way to fill that out is to read the manufacturer's recommendations if you buy disinfectant and kind of put that language into this section. If you can't do engineering controls and you can't do administrative controls, you have to do personal protective equipment. If you have engineering or administrative controls, depending on what they knock out, you may or may not need personal protective equipment. So if you use my
that's
example,
really good to know. That is different than what I assumed. Okay.
if you use my example of the guy in the bubble, he doesn't need to wear gloves. So it's hard to get away from it, right? But you could under certain circumstances. The personal protective equipment that is provided is not specified clearly in the governor's order, but it's not, it should be familiar to most employers. The type of personal protective equipment that we're talking about is personal protective equipment that protects the employee from the modes of transmission of the virus. So for fellow employees, right, the fact that they could cough, sneeze, and produce COVID, we're talking face coverings, right? We're talking cloth face coverings or surgical masks to prevent surfaces, right? We have a cashier who's working at the cash register, who's handling credit cards, who's who knows what, handling goods that the public handled. Gloves, right? Nitrile gloves or whatever. So you look at where the employee could contact the virus and you protect them in that area. So personal protective equipment for the virus should always include face coverings for everybody. It's part of the governor's order. You wear a face covering when you leave home and basically all the time unless you're medically unable to, or there's a couple very narrow exceptions. So certainly you're going to have non-medical grade face coverings as part of your PPE in this section. And then I would recommend, you look at things like disposable gloves. You look at things like if they're in an area where they might get sprayed with stuff. I know that sounds gross, but maybe garbage collection or something like that. A bag might rip. They might want coveralls, to protect other parts of their body. There's science that shows that coronavirus can infect people through contact with the eyes, as well as, contact with the mouth. So you may need, if there's a lot of stuff spraying, face shields or something that covers all the head. As you can see in the italics there, you need to assess the distance that an employee can maintain as part of your PPE assessment. When people work really close to each other, such as in construction or other manufacturing where it's a team project, they may need to wear more than just the face covering. They may need the face covering and a face shield. So for PPE considerations, my PowerPoint went through a lot of those. The governor's order is specific for some industries on what PPE must be issued. So, consult that governor's order as you're working on this. After we've done those employee protective things, once we've looked at plexiglass shields, limiting the number of customers in a place, giving our employee a face covering and some good disinfectant and cleaning their workstation a lot every day, then we get down to health surveillance, which we had a question on. The governor's order does require employee health surveillance, but they don't really direct how it's to be done. So, for example, for construction, they say if you can get a no-touch thermometer, you need to use a no-touch thermometer, but they don't say that for the other industries. So one of the easiest ways to do health surveillance is an employee questionnaire. As I mentioned, I've seen some apps that have been pushed out. Some places of business have a QR code that they put on the front door that people take a picture of that leads them to the questionnaire. They must be done prior to the start of the work shift. So you want that to be the first thing an employee does when they show up. Either they do it before they get to the job site, or they do it first thing when they arrive at the job site. Because the idea is, depending on your answers at health surveillance, you may be directed not to work, right? You may be directed not to come into the workplace. So you want that done pre-entry if possible. That's why it's called an entry screening protocol.
So let me ask this question, and just for those of you who signed in after 9:30 or so, we have been utilizing the chat for a lot of additional resources. So I've got two just kind of things. We're hitting our first hour here. This will be a long workshop. We are going to take a break probably around 10:30 or 11 to let everybody go grab coffee or use the restroom. We know 3 hours is a long time, but I just kind of want to recap what we've already covered and what's available to you. And if you can't see it, just message me or Maida and we will get it to you. Maida Orozco is my assistant and she's going to be helping with, kind of managing the chat in that. So if you would please introduce yourself if you have not yet done so. And we do have a couple of questions. So Bob Cooley is asking that you mentioned that the governor mandates that all employees must wear masks. Are the employees required to wear masks at all times if they are able to maintain a distance of 6 foot of separation? So for example, if your employees are sitting at their desk and the desks are 6 feet apart, do they have to be wearing their masks while seated? That's like a really clear question and answer on that one.
Yeah, and I'll give them a really clear answer. I'll just hop over to this guidance here. Yes, so the rule is most employees will end up needing to wear a face covering, just due to the fact that what I'm pointing you to is 1F on my screen right now. Which says when employees cannot consistently maintain 6 foot of separation from other individuals in the workplace. Consistently maintain is a very high standard.
Sure.
It means if they're within 6 foot once, they need to wear a face mask.
Could they be taking it off and on all day though? Would that be okay? Like kind of like how the restaurants are handling their customers, where you wear it when you're getting up to go to use the restroom or when you're coming in and coming out. But if you're sitting at your desk and working.
Yeah, so according to the CDC recommendations, they describe 2 types of respirator use. There's extended use and reuse. Extended use is when you wear the same respirator all shift, and reuse is when you wear the same respirator all shift, but you take it on and off throughout the shift. And the CDC guidances require extended use wherever possible instead of reuse. So if you hold the fact that they want us to follow the guidance in here, combined with the fact that it's to be worn whenever you can't consistently maintain it, it's not explicit. I wish I could give you a clear answer, but my best guidance.
That's important though. That is important to understand that it is
my
not
best
explicit.
guidance is employees who ever need to come within the day, within 6 foot of another person, would need to wear the mask the duration of the shift. If all shift they can stay 6 foot away from people at all times, they do not need to wear the mask.
Got it.
With my interpretation. But we didn't write these, the governor did, and she didn't write them quite the same way that we would write our standards. Insofar, sometimes we're too clear.
Yeah, no, I appreciate that. That is really, it's important to make these, these clarifications, because obviously every job site looks different, right? So depending on where you're at.
Yeah. And I was hoping to find one where they have to wear it throughout the shift and it's very clear in one of these vertical standards. but I'm not seeing one. I want
Yeah,
to.
I've read through it all pretty carefully, and I have not seen that. And so
Yeah. So
Bob's question is actually a really good one, and I have been asked that, again, of smaller offices that maybe only have 3 or 4 people, and for most of the day they're each in their own cubby office, sitting at their desk.
Yeah,
They
and
get up to use the restroom, and they get up to use the common eating areas and things like that. But for the most part, everyone is sitting
right
where they need to.
Right, and I think that's fair. I think you could read it this way. Like, I'm looking at the office one, which is now 7D. 7D says, we require the face coverings in shared spaces, which would imply that in non-shared spaces it's not required.
Right.
So
yeah, so if somebody does have their own office area,
I guess caution would be the best advice.
Of course. Karen Burton is asking, which order is this? Do you mind letting me know so that people can pull it up if they want to?
Executive Order 2020-114. And what I'll do is I'll throw the link in the chat right now that I'm looking at.
Thank you.
This is really the guidance. As far as I'm concerned, as far as OSHA's concerned, this is really the black letter, clear law on what businesses have to do in Michigan.
Great.
If you read guidance from OSHA or CDC, some of their national guidance, some of the other states have lower requirements. We have higher requirements than some of the other states. So if you're really looking at what you need to do, you need to look specifically to this link.
Thank you. That's really clear. We appreciate that. But
And
just so everyone knows, we are recording this workshop because it is a 3-hour workshop. We recognize that not everyone is going to be able to stay on for the whole call or stay attentive to the whole call. If you would like to receive the copy of this, if you want to put your email in the chat along with your name and your company name again, Maida will grab that and we'll make sure. Also, the other option would be is if you did sign on with the Eventbrite that we had, that would also do it, and I can put that in the chat. That might actually make it easier for us to grab everyone. So if you're interested in getting this, I will give you the Eventbrite that was for the pre-registration, that was not required by any stretch, but was would allow you to have additional information. So we'll be sending that out. We'll be sending the recording as soon as it's available, probably first thing tomorrow morning. And then that'll be shareable as well. So I just put the Eventbrite link in the chat. If you want to click on that, if you didn't already register from that, this would be one way for us to capture your information and get stuff for you. So thank you. Okay, it's all yours, Tony. Take it away.
All right, we'll get the document back up here. Sorry about that.
No problem. This is perfect. This is the way.
And Bridget, I just emailed you that Ingham County.
Perfect. Thanks.
Screening.
I hadn't gotten to that one yet, but I was looking for the ones that were closer to us, so that's perfect. I'll do that. So, the other counties don't seem to have the same type of thing. At least they weren't easy to find. So I'm glad.
Yeah. So we pushed.
No, of course, because that's where you guys are located, right? Right. So for those of you who are looking for a really good sample survey, Tony put up the Ingham County Health Department screening protocol for employees. And so I am attaching that now. It is a Word document. You can download that and edit, just pull out the Ingham County and just edit it with your company's name on it. And there you go. Another option, obviously, is to also, hey, BJ, good to see you. I haven't seen you in a minute. Another option is to also create a digital survey that you can create because you are required to keep these records, and we believe it is for 3 years. So if you're doing paper, you can either scan them every day and keep them that way, or you can keep a note, a binder with all of them. But it is required that you keep these screened records for the state of Michigan. If you're ever audited, that would be a required thing to have. So I'm going to be hoping that we create some sort of a digital tool going forward that would be a little bit easier. There are some mobile apps that are available that specific larger employers like the automotive companies have created for themselves. But it is, you know, something that's really, really important to keep these records. So.
Yeah, there's a business opportunity for somebody who's into app development for sure, if they want to jump ahead of some other people. People need an app for this.
For sure. Yes, I've got a couple of small app developers that are micro businesses that maybe they can help us to create something super simple and
Let me know if you guys put anything out, Bridget.
Yep. I'm on it. I'm on it.
Yep. So we had a question about my employees need to do surveillances. Does anyone else? I made reference to the construction industry, you know, having a little bit higher requirement. Manufacturing, I also see on this page that I'm looking at right now. So non-construction, non-manufacturing, you're only looking at your employees. If you're in manufacturing or you're in construction, we're looking at who's coming into the facility or who's going onto the site.
Okay.
So there are, like I said, if you read 114, there are certain business sectors that have higher requirements because they're believed to be higher risk. Manufacturing, you know, people are in an enclosed indoor space with each other. Construction, you're typically working side by side with other guys, you know, getting something into place or on a task. So
yeah, for sure. And we do have a number of construction companies on the call. And so I think, you know, creating a digital tool that you can utilize because your job site, you know, maybe in multiple locations, right? And so to be able to screen your employees and your subcontractors and your trades and things like that on and off site, having that digital tool, we will be on that like immediately. We're going to be working on that.
And the construction questionnaire needs to be site specific. They're trying to do some contact tracing with it. So the first field is,
there should be a GPS. There should be some sort of a GPS feature maybe.
Yep, exactly. That would be great too. Yep. So typically only employees, manufacturing and construction, you know, it's anybody that has to come on the site. And if you read the governor's order, step one is the minimum number of people come onto the site, you know, period. You want to keep people off the site to the extent possible, you know, no tours right now. But the people who do need to be on site to deliver materials or take waste off, yeah, you need to get that information from them. This section underneath specific instructions, detail reporting instructions to provide to employees here. This is very company specific, right? You're going to need to put in the name of your supervisor on the site or the name of the owner or the name of the manager, whoever has authority, whoever's the boss at that location. You need to put in, you know, call this number, email this email address, you know, put this subject in the subject line. You need to get very specific for your employees here. With the idea being, once you've generated this plan, it's, you know, either emailed to your employees or they're told where it is. And then this tells them, you know, how to get their PPE, how often they need to clean their workstation, and who to call if they're sick. That's this part. What do you do if you're sick? And I can't really consult on human resource legal matters, but what to do when you have an employee who's sick is a very tricky question. And what you do in response to that as a business owner. So, you know, make sure that you consult with the appropriate people. I think I saw some resources on the Reopening Detroit website, Detroit Means Business, for some expert help on those matters. Okay, training. No matter what you do, you need to provide additional training to your employees as part of your response and preparedness plan. You know, that previous presentation I went through was hopefully going to be a train the trainer type where people got the background information they needed to cover this stuff. But if you didn't manage to get to that, I gave a PDF to Bridget, which she also put in that Google Dropbox, that has a lot of great resources for this training. And I'll jump to that right after this. But somebody needs to come train your employees. I can train anybody on A to G. So whoever your appropriate person is in your business, hopefully they're on the call right now. We can go through all this information. For starters, CDC has slide decks that you can use. So get that information and present it to your employees. So the routes that it's transmitted is through aerosolization, right? Through sneezing, coughing, things like that, where your respiratory tract ejects particles and they can be breathed in by another person. It can only travel a certain distance in the air. It doesn't remain viable in the air very long, especially outdoors. Ultraviolet light seems to have a great effect on COVID. However, it lasts a long time on environmental surfaces. Days, apparently. Could last 1 to 2 days on a lot of surfaces. That's why we do the wipe down of our surfaces. Symptoms are massive. I think the list of symptoms is up to like 15 items now. It started with coughing and sneezing and a fever, and it's up to loss of taste and smell or body aches and a lot of weird non-specific things. D, that's what's above here, the detailed reporting instructions. So that's what you train them on, you know, what to do if you have symptoms or if you're sick. E, the measures that you're taking to prevent. That is this entire plan. You would basically just read this plan to them for that E topic in training. F, rules that the worker must follow in order to prevent exposure to and spread of the virus. Once again, that's this plan. You know, we require you to wear this personal protective equipment, to maintain this distance, to do this health screening and not to come to work if you're sick. And then G is where it gets a little tricky. Whatever you give somebody to protect themselves with, you need to train them on. Gloves. Gloves are intended to be a temporary barrier and disposed of. If your employees are wearing the same pair of gloves all day long, they're probably increasing their risk because they're not washing their hands, and they're not washing their gloves, and whatever they touch is probably staying on those gloves. So you got to make sure that they know how to properly wear them the right length, wear them properly, how to take them off safely, put them on safely. And that's not just the gloves, you know, that's their face mask too. If you're giving your guys surgical masks to wear at work, it's important for them to know, you know, not to handle those a lot. We talked about, you know, putting masks on and off throughout the workday. That's not the best way to use a mask. It's actually more, you know, touching of the face and mouth with your hand if you do that. So there's great resources out. You can Google, you know, and YouTube or whatever, how to put on or take off a face mask, and there's 10,000 videos. Certainly CDC and NIOSH have resources, as does OSHA, as do I. If you need any resources for any of this stuff, just ask me and I can get them for you.
Okay, that's actually one of the questions. So Paul from the Southwest Detroit Business Association, he is our, I don't even know exactly what your title is. Do you want to go ahead and unmute yourself and ask some of the questions that you've had? You've had some really good questions.
Well,
so far.
I'm the facilities manager for Southwest Detroit Business Association, overseeing 2 buildings, and also I am the operations officer for Way Academy, which happens to be a tenant of one of those buildings. So I have 2 different perspectives to be concerned about. That's why the school question came earlier. As it happens, with the school being in one of the buildings, it helps in terms of applying all the things that need to be done pretty consistently. But I'm guessing the school standards are going to be a little higher than they would be for other entities because of the proximity of students and teachers, et cetera, and the significant flow of traffic of people coming from outside and interacting. So those are things that I need to come together with. But I had a question on whether are there training videos and online sites that we could use or incorporate or even put like on our website or whatever to be readily available to, frankly, anybody that might come in contact with our websites.
What topics?
Well, the cleaning, the fundamental topics, all the ones that, frankly, everything listed in the requirement in the
Yeah.
this
So
document, and a plan, I'm sorry. And yeah, anything that might be required that we could do that with would be, I think, particularly helpful. And if we did it on the Southwest Detroit Business Association, then it'd be available to any member,
Correct.
and also for the school to do it for any student and parent and anybody else that's interacting. So it seems to me pretty logical approach.
absolutely. I am hitting this up.
While he's looking for some resources for us, and maybe Tony, maybe you and I could work on that document and maybe create some, maybe some video links that'll be all in one document that'll be really easy to share. That's something that we could work on, after the call. But one of the things I would like to mention, if you go to Techtown Detroit's Facebook page, their CEO and president, Ned, did a Facebook Live as Techtown is opened up now. They've put all of these types of things in place. And he actually did a walkthrough of their whole facility on Facebook and made a video, walking through the whole process of, they've got, because it's such a huge facility, they've got the arrows on the floor and the wayfinding and all of that because it is such a large space. And so I thought that was a really interesting way. And so Paul, maybe that's something that we could do with each of the 3 spaces and show people like this is what's expected. You walk up the door. When you come up to the door, you're going to see a sign that says, masks required in and out. When you come up the stairs and you're going to be here, please don't cross on the stairs, things like that. And then obviously with the school, individual schools I think are going to need to make their own videos because every facility is going to be a little bit different.
Well, and there's an overlap here too, if I may, Bridget, in terms of landlord responsibilities versus tenant responsibilities.
Absolutely. Absolutely. We have a unique situation because we are landlords as well as everything else. Thank you, Ppe, for putting that up. Yeah, you guys, that was a fantastic video. I watched it last night and shared it. It was shared on the City of Detroit business owner page as well. And it's just a really fantastic example. So Paul, if you want to capture that, maybe share that with, Rob probably has already seen it because he follows Ned on Facebook, but I think that would be a really helpful thing for you or Rob to create. It's in the chat. So Ppe just posted the video that Ned posted yesterday.
Okay.
So yeah, I will commit to creating a document that has videos. It looks like we've got a few here that have already been created. So thank you for popping those up. And then we had a few other questions. So while we're on this,
Can I address that question?
please, yeah.
Yeah. So I got up. So I provided this to Bridget previously. This is a very actually, I hope this is nope. This is not the right one. I'm sorry. I'm sharing the wrong document. I sent over a document that looks a lot like this one. That's not this one. 526.
Oh, yeah, that's 526.
Okay.
I can pop it up in the chat.
And this is going to have all those resources in it. You might there are links to videos then in this? Yeah, so what you're going to want to do is you're going to want to go to not the OSHA resources, the CDC. So the CDC COVID-19 official webpage. Can you guys see this video that's up or the screen that's up right now? No?
We see CDC official website. Yes, we do.
Yep. So you're going to want to go to the CDC document, and that will address disinfection, donning, doffing, safety practices. Are there
videos there though? Or is that, that's what we're looking for right now. That was the direct question.
Yeah. So your best videos are going to be put out on YouTube by the CDC. So
Got it.
I would do a YouTube search for CDC because the CDC has them on their page, but you'd have to hunt them down. And I think there's a better search function through the private sector YouTube that'll pull them up a lot faster.
Got it.
But I want to point out the American Industrial Hygiene Association Back to Work Safely resources. That's going to be huge. That's going to be very on point. And as far as the facilities management type questions, NIOSH, CDC, these bottom two, guidance for reopening buildings, and employer information for office buildings, or reopening guidance for schools. Those are all going to be great resources for that question that just came up. That's all I wanted to say.
Perfect. All right, so there is the CDC does have their own channel on YouTube, and so I'm putting that link also in the chat. So we did have I had another private question for a restaurant. So restaurants have vendors who come in usually at the beginning of the day to drop off food and things that they've ordered. Do we have to question our vendors if they're just coming and dropping off, boxes of produce and things like that? Is that something that is required of our food facilities or restaurants?
No. So I'll try to get the governor's order back up again. So I'd like to point out, where people can find answers to questions, just in case they have a future question.
That's huge, yeah.
So, and this is tracking as I change my screen around, right?
It is not.
Okay.
You're sharing one thing at a time, so you got to unshare it and share again.
Okay.
Because otherwise we can see your whole screen and, anything that you.
Yeah, there's a lot of stuff in there.
Yeah.
Okay, share.
Right. I'm going to post the order again. Tony posted it about 20 minutes ago, and so it may be buried in the chat. So this is the executive order that he keeps referring to. If you have not downloaded this to your computer, you may want to.
So unlike construction and manufacturing, there's no requirement on restaurants to survey, like do that health surveillance of suppliers. However, if you look, they do have a duty to notify employees if the employer learns, I don't know how you would, but maybe just through word of mouth, that a supplier has visited the store, who had positive COVID.
Got it.
So that's the only requirement on a restaurant. So there's no duty to ask, I guess, the question, but if the answer comes out, it prompts some additional responsibilities.
Good. That's good for us. No.
All right, and we'll get the new share, get the Word document back up. Okay. So we were just getting through training. So this is your training checklist. If you do your employee training, you can just basically check off items A through G as you go through it, and just make sure that you address all those with the employee. MyOSHA has template PowerPoint programs as well. If you go to our main site, michigan.gov/MyOSHA, click on the COVID resources banner. It's giant, it's orange, it's on the first page that opens up. You can't miss it. We have PowerPoint presentations very similar to the one I gave at our last meeting. They are specific to different industries and that contain some of this information.
I'll get that link up in just a second. It didn't pop up. Really quick, Tony, this document that we're creating, would it make sense just to literally give this to our, like actually give them a hard copy of it or a digital copy of it? Or is it required that they should be given it?
Give who?
Our employees. Should we give our employees this document?
Yes, your employees must be provided with this document. So that can be, email a PDF to them, hand them a hard copy, or, just tell them where they can find it. Hey, I've completed the response plan. It's located on the Google Drive. Click here to see it. All the employees have a right to see this. Yep.
Yeah, so that's, I think, is a really important thing that I don't think has been made widely known. That the plan, obviously, people who now know that the plan has to be created may not realize that not only does it have to be created, it must be shared. So I think that's really important messaging that we provide at a very high level, overview. So
absolutely. And so the duty is to provide to employees, that they're the only people you have to provide it to. but I would advise that it be provided to anyone upon request. You know, if you have a customer or
Of
supplier,
course.
somebody, just share it out. There's no harm in sharing it.
Yeah.
So once you get through your training, the last section on the template here is record keeping. So keep a record of the training, the self-screening protocols, and any positive identification of a confirmed case of COVID. Like we said, I think we all agree it's 3 years that you keep this information for. But, you know, as executive orders change, you know, everything in this is kind of, we don't specifically address any executive order because they replace each other. So this document can survive a change to the executive order numbering.
Sure.
But yeah, we just say, you know, in accordance with the executive order, which right now I believe is 3 years. So that is the template 8-page program. This last page, page 8, is contact information for my division, our main office. You can contact the main office for services. In fact, if you're asking for a consultation, they kind of want us to route it through them. But you can also use my personal information, and if it's something quick and easy, we can just do it informally, hammer it out. And if it requires a lot of time and effort, I'll walk you through how to get, you know, the approval from the state. Wasn't too painful, was it, Bridget?
No, we're actually only at an hour and a half here. So
Yeah.
what I'd like to do right now is allow people, if you'd like to take a short break, since we're about halfway through our allotted time, and then what we can do is come back through it and get some feedback from people of what they're experiencing, what they're managing, and then be able to take any additional questions. So let's
I like it a lot.
do maybe a 5-minute break. It's 10:30 on the dot. That was like perfect timing. So we'll come back at 10:35 and be able to walk through these and get some feedback from all of you. So I'm going to actually pause our recording and maybe put on some Pandora in the background here, since we're not recording this. So nobody report me to using music that does not belong to me. Thank you. We'll see you in 5 more minutes.